Hello and welcome to News Up Now. I'm Gleidson Martins. Many people are struggling with anxiety, panic attacks, depression. But what is the difference between anxiety and panic attack? And how to deal with depression during the pandemic? Well, to talk about these issues, my guest today is Dr. Howard Rubin, the psychiatrist in San Francisco Bay Area. Hello, doctor. Thank you for joining me on News Up Now.
Thank you for having me.
So let's start with anxiety and panic attack because I'm a very anxious person. It's just like it's natural of my personality, I guess. But what is the difference between anxiety and panic attack?
Okay. Well, first, I think it's important to say that anxiety is a normal part of human experience. It's part of our body's alarm system to alert us when there's danger. But we like to think of excessive anxiety, where people are anxious most of the time, as fear or worry that's with us all the time and is very over the top, more than we would expect from a response to a quote, quote, normal danger. So that's sort of anxiety. And when we talk about panic disorder, as opposed to generalized anxiety, one way to think about it is anxiety is where the water is simmering, and with a panic attack, we're at a really hard boil. So it becomes a very concentrated, intense experience of very intense anxiety, which comes on suddenly and then sort of explodes.
So, but you mentioned to have anxiety, it's part of our nature, I guess, right? But when someone can, what are the signs when the level of anxiety is too high and someone needs to find help, to get help?
Yeah, absolutely. Well, I think when it's too high, it's interfering with functioning. So that if someone is having trouble with school, if it's having trouble in their personal life, is having trouble with family, if the anxiety makes it difficult for them to do the things that they normally do, then we think that it's something that comes to clinical attention.
Mm-hmm. And when it comes to panic disorder, and is that some signs that you can give it to us?
So typically a panic attack comes out of the blue and it's very sudden, and there can be a range of symptoms. So they can be, you can feel like you're going to die. Some people will say they're feeling like they're having a heart attack. They'll have chest pain. They'll feel short of breath, lightheaded, that they're going to faint, tingliness in their arms and feet. So it can be any or all of those symptoms. And it's a very frightening, very intense set of feelings that happen very quickly.
One time I heard of somebody saying, but those symptoms are not real, but they are, right?
They're absolutely real. They're what people are experiencing. And very often people go to an emergency room thinking they're having a heart attack. So it absolutely is real. But maybe the etiology is not someone's having chest pain because they're having a blockage in their heart. They're having chest pain because they're having very intense anxiety.
Are you noticing more people with anxiety, high level of anxiety and panic disorder during the COVID-19 pandemic?
Yes, especially in my practice, I've seen a lot more people with anxiety. I think that what we've been asked to do with shelter in place, what we've been asked to do in terms of staying home, wearing masks, has created a situation where people are becoming a lot more fearful and a lot more anxious. We see this in children, we see this in adults. And I think in some ways it's a quote, quote, normal reaction to a very unnatural situation with the epidemic, but it's been very disabling for a lot of people.
And what is the best recommendation? Let's say I assume there's a certain level of anxiety or the panic disorder, somebody needs to get into medication, right?
Absolutely. So there are several treatments for anxiety, excessive anxiety or panic. One of those is medication. So there's a class of medication called SSRIs, which are selective serotonin reuptake inhibitors, which are very effective and usually pretty safe. We also use cognitive behavioral therapy as another way of treating panic disorder.
So during the pandemic, I noticed myself, sometimes there's some downs and you think when whole thing is going to be over, right? And I assume many of us all over the planet are having some dark days like that, or down days, if I may put that way. What is on certain level, is that some sort of normality over there during the pandemic?
Well, I think, sadness and anxiety can be normal reactions, but again, it's when those feelings don't go away, when they last for a very long period of time, when they're more than just a feeling down for a day, but a constellation of things come together for a longer period of time, for at least a couple of weeks with depression. So think about low mood, lack of ability to enjoy things, low energy, fatigue, blaming yourself for things, maybe poor concentration, thoughts about death or dying. All of those things together, we like to think of as coming to what we call major depression.
But if someone is feeling those symptoms uh, on one time, let's say per month, or once, twice per month, it's kind of normal, or is it?
Yeah, exactly. Well, I mean, I think it's all a question of proportion. If it's happening once in a while and it's not really interfering with your ability to do your work or to be present for your family or friends or impacting your quality of life, then sure, we don't worry about it. It's when it's happening every day, most of the day, that we start to get worried.
Yeah. And I assume panic attack, it's kind of a weird, there's some weird sensations because it comes from what you said, nowhere. It just
right. They can
like
really
that.
come out of the blue, and it's very frightening. And as I said before, many people go to the emergency room thinking they're having a heart attack or their stroke because they just don't understand the symptoms.
Okay, we have a couple of questions here from social media. The first one, are people more depressed during COVID-19 pandemic?
I haven't seen any statistics, but certainly subjectively in my practice, I've seen a lot more people feeling depressed and isolated, very isolated, and just not being able to connect. And I think that leads to more depression.
Okay. And before I go to the second question, what are the signs of a depression? Because we mentioned about being sad or being anxious. And then I guess, if I may say, the next level would be depression, but what are the first signs of it?
Right. So depression is something that we think of as lasting for more than a couple of weeks. And there are two signal symptoms. One is depressed mood, so feeling sad or low. And the other is something we call anhedonia, which means lack of pleasure in things. So all the normal things that you enjoy, whether it's going to a movie or playing tennis or reading, all those things just have no meaning. So those, you have to have one of those two symptoms, in addition to other symptoms like problems with eating, problems with sleeping, problems with concentration, having fatigue, low energy, feeling like you're moving underwater, maybe even at its worst, feeling suicidal. So those would be some of the signal symptoms of depression.
So the next question is, what do people do if they don't feel supported by their doctor when they're asking for help with anxiety and depression?
Mm-hmm. Well, I assume they're going to a primary care physician, I think it's important that they communicate pretty clearly that this is not part of business as usual, right? So that this is different from their usual way of being and doing, and that they really need extra help. Very often primary care doctors are so busy that they come in and they say, okay, tell me your top two problems. And one of these needs to be on your top two problem if it's impacting your quality of life. And if necessary, if you feel like your primary care doctor is not helping, try to ask for a referral to a specialist.
The pandemic, it's hitting everybody, right, in so many different levels. But people losing their jobs, the situation of rent in the Bay Area is just too crazy, chaotic. But then there are two sides of every single story, right? So I'm not going to go there. But I guess what I'm trying to figure out is, when is recommended for someone to, let's say, I lost my job. Should I stay home, applying for jobs? How much of my time daily I should dedicate it to myself to do something that is enjoyable, and sometimes just go to a park or go to do some exercises, physical exercises.
Well, what I always tell people, it's very important to think about what I call basic maintenance. So for each of us, we all have, there's sort of a package of things that make us feel good. And so it's very important, especially during these times, not to neglect your basic maintenance. So that might be exercising an hour a day. It might be reading. It might be spending time with someone in your social bubble. So to really make sure that the things which give you pleasure, meaning, purpose, satisfaction, that you don't neglect them.
Okay, last question is, I know I have to do a couple of things. I know I have to work out, but every day I tell myself, okay, tomorrow I'm going to do it, but I never do. So what should I do?
What I would say is break a large task down into small pieces. So if the goal is not to run a marathon tomorrow, the goal is to get your shoes on and get out the door and walk around the block. And that when you accomplish that and you feel good about it, then you can set another goal that's achievable. Don't go for the big goal right away. It's very difficult to achieve that, but break it down into doable pieces.
Okay, so last question. I know we're running out of time, but if someone has depression, anxiety, high levels of anxiety or panic disorder, are those people qualified to get the vaccine? Do you know any statistic, any knowledge?
Absolutely get the vaccine. Absolutely. There's no contraindication to getting it. I mean, obviously talk to your personal doctor to get, proper medical advice, but absolutely they should get it.
Okay. Well, Dr. Howard Rubin, psychiatrist in San Francisco Bay Area, thank you so much for your time. I really appreciate it.
Yeah, glad to be here. Best of luck.
Thank you. And thank you so much for watching. If you have any questions, comments about this interview, about anxiety, panic disorder, or depression, please let us know at tips@newsupnow.org, tips@newsupnow.org. And also, we're going to write here the email of the Dr. Howard Rubin. If you have any questions for him, you can forward either to us or you can send straight to him, okay? Thank you so much for watching. Once again, be safe, be kind, and I'll see you next time.